Hello, my name is Jessica Howe, and I'm the Learning Disability and Autism Lead for the London Ambulance Service. I led in the development of this new guideline on learning disabilities and autism, which will sit in the general section of the JRCALC clinical guidance and the JRCALC Plus app. This is a completely new guideline relating to the clinical care provided to people with a learning disability and autistic people. The purpose of the guidance is to create a practical guide for clinicians when at a patient's side, to improve patient care and outcomes. It emphasises health inequalities and preventing avoidable deaths in this patient group. The development process was based on clinical best practice, themes from incidents, reviews, and national leader guidance. It was created using the clinical experience and expertise in the National Ambulance Learning Disability and Autism Group, and was a thorough collaborative approach with different professional groups. In the guidance, there are some useful tools and tips which include important information on varying essential considerations to your practice. Some of these include reasonable adjustments and how we make them, how we consider adapting our communication and understanding others' communication, soft signs of deterioration and alternate signs of pain that are essential we consider and listen out for in our assessments, comorbid presentations that we need to consider as part of our clinical reasoning, how we assess capacity and support best interest decisions and the nuances of that with this patient group, and how we support conveyance, which is a regular topic which comes up that our colleagues would like more support with. These focus areas are important for many reasons. We know a person with a learning disability or an autistic person might need additional support to ensure effective communication, which may be especially important when stressed or anxious, which is more likely when in contact with our service. If a person is presenting with behaviours that are challenging to themselves, others, or you, it's really important we consider what that person is communicating and understand this as distressed behaviour rather than challenging behaviour. The person might need support interpreting their behaviour to meet their needs, and we have an essential role in that. From a sensory perspective, attendance and assessments by ambulance crew will increase the demand on a person. Stress and anxiety relating to being unwell and that attendance by ambulance staff can make self-regulation much harder, reduce engagement, increase anxiety, and impact on someone's communication as well. This can really negatively impact on a person receiving the care that they need, and so we must consider how to adapt our practice and support sensory sensitivities to make sure someone can engage with the care that they need. I also highlighted soft signs of deterioration and alternate signs and symptoms of pain in this guidance. Presentations of ill health and physical ill health might be different than we would be expecting, with vital signs different from typical ranges. For example, some people with a learning disability may struggle regulating their temperature and not develop a fever with infection or sepsis. It's really important that we consider somebody's presentation as symptoms of physical ill health, not in relation to the person having a learning disability or being an autistic person. As an essential part of your assessment, always consider subtle and personal early indicators of illness to ensure that we don't miss soft signs of deterioration. The guideline has a table which includes those soft signs of deterioration to look out for, as well as talking about how pain might be shown atypically. Distress and discomfort might be shown with a variety of verbal or non-verbal cues, and we have to consider those as part of our information gathering. The guideline has a section on mental capacity and a checklist to support your assessments and best interest decision making. People with a learning disability must not be assumed to lack capacity, but there are reasonable adjustments that we need to ensure that we make so that people can fully take part in those capacity decisions and best interest decisions. So JRCALC have not specifically had a guidance before for this patient group, and following feedback and recognising that people with a learning disability and autistic people are more likely to have poorer experiences and health outcomes than the rest of the population, it was agreed that this really did need to be included. We hope that this guidance provides the information required to support necessary skills and confidence in delivering best practice to every person we support who has a learning disability or is an autistic person. If you've recognised a patient has one of these diagnoses, please consult the guidance to inform your clinical reasoning. Ensure you have considered everything required within your assessment and made all of the relevant adaptations to deliver safe and effective care.